We are here with Dr. Singh. Welcome. Can you tell us a bit about your background and your job?
Greetings. I'm Dr. Jaspal Singh. I'm a pulmonary and critical care specialist. I trained in medical school in Chicago and then did residency in New York and then fellowship at Duke University in North Carolina. When I graduated, I didn't want to leave North Carolina, so we ended up taking a job in Charlotte, and I've been here for 14 years. Love what I do. I'm a pulmonary and critical care specialist. I specialize in lung health and also in intensive care medicine. And so along that way, I chose that profession because I like taking care of very complex issues and patients who are very sick and in need of life support. That energizes me. But I also take care of patients in the office who have general pulmonary and especially cancer-related lung problems, as well as sleep medicine. So I have a nice practice in Charlotte, North Carolina, and then it's just changed a lot. Since the last year and a half, things have changed quite a bit with COVID.
So we still haven't found vaccines for HIV and cancer. So how did we develop the COVID-19 vaccine so quickly?
The COVID-19 vaccine process has been something that's kind of been in the works for a couple of decades. And so the scientific knowledge there has been in play for a number of years. I mean, we knew of the scientific community, when I say we, the scientific community knew of all kinds of potential threats to the human population. And to be honest, as much as we've had a lot of scares in the last 20 years, from Ebola to MERS to SARS to a bunch of things, for the most part, the US and much of the world has been lucky. And so when the COVID-19 virus emerged, when the coronavirus emerged, the SARS-CoV-2 virus emerged as a true pathogen, the scientific community worked really quickly. And a number of trials, a number of investigations, and pretty much once the numbers became almost staggering and overwhelming, it was an all-hands-on-deck global effort. I mean, I've never seen anything like this. I don't think anyone's seen anything like this. To develop vaccines, to develop all kinds of opportunities. And there were a number of vaccines early on that were in the pipeline, very early on. And so different mechanisms, different ways of attacking this virus, different ways of using the host or the human body to fight the virus. And so a lot of things came in the works. Just like we also did vaccines, we also did clinical trials. And so combination of vaccines were the scientific community kind of accelerating, stepping on the gas on a couple of things that really seem to have the most promise. And as you narrow that focus, more data emerges. A couple of leaders came in that play. And I have to say, you kind of get lucky. Well, call it luck or grace or whatever you call it. The scientific community did get a little bit lucky that the viruses not only were effective, but so effective. The vaccine were effective, but so effective. That was almost unheard of. So that was exciting. It was an incredible discovery.
How do we know that they're safe?
Well, we have hundreds of thousands of patients. I mean, bottom line is you take your best guess based on historical information, how you make vaccines. We've made vaccines for decades now successfully in other types of disease states. You know, we've eradicated certain diseases because of vaccines. And so the vaccine process and testing is nothing new. There's nothing magical about that process. And so then you have to, at some point, test it on people. You start with animals, then you go to eventually to people. And so once you get to people and you realize, wait, this is actually as promised, and you monitor carefully. Now the vaccines here that were made with incredible scrutiny. I mean, everybody was looking. And what's interesting is when we made these, it wasn't like many times the pharmaceutical industry companies make vaccines and nobody shares the data openly because it's a commercial entity. It's something that you want to make a profit off of. But this was unique that the world was sharing the data openly. I mean, to the point of so much transparency that we've not seen this before. And so it was neat. It was neat to I could communicate with someone who's a clinician that's in China or Italy when the Italians were ahead of us in this pandemic. And so the amount of global sharing here was something we have not seen before, and I think really shows the true human grit of what's possible when people work together across the globe. I mean, the amount of data dumping, we got data from primary data, which we've always asked for in certain medications and things, but we haven't seen it to this degree. And I think that the public needs to know that there was so much transparency in this process that the safety profile of these are incredible. considering what we were able to see.
How is the Johnson & Johnson vaccine different from the Moderna and Pfizer vaccine?
Well, the Johnson & Johnson vaccine has certain unique properties to it. Again, it's a vaccine. Now, what's nice about it is you only need to take one shot. It works a little bit differently, but that being said, it's extraordinarily effective. And we've used it actually in our community, particularly for people that may not be able to take two shots reliably. Well, it turns out a lot of people who've had the Pfizer or Moderna vaccine, many of them haven't come back for their second shot. And so this is where the Johnson & Johnson vaccine potentially may have an advantage because one shot is pretty effective. Now, it had a little bit of a hiccup at one point. There was some concern about the development of blood clots and some of these concerns. So the FDA and the company actually paused their rollout for a couple of days. And just to make sure that the data matches, that they're seeing undisclosed cases. Since then, the vaccine went back again and back on board, and we're still using it quite a bit. And many patients are still opting for that. Many of my own patients are opting for that vaccine because it's one vaccine, and they feel that they're pretty comfortably protected with that.
What do we know about how long the vaccine will protect us and how well it works against the variants?
The efficacy is incredible. I mean, we've seen it at the bedside. I mean, there was a time where our ICU intensive care units were completely full of patients dying of COVID. And once the vaccine rollout happened, I mean, you can see it's a palpable change. And now, unfortunately, the vaccines have sort of, people are slowly, not as readily taking them, who don't want to take them. And that's a concern because now we're seeing, again, my friends around the country all of us are seeing this massive increase in cases, and they're universally of people that are unvaccinated fighting for their lives now. And that's a very scary thought, and it's tragic because it's avoidable, in our opinion. For many adults who are eligible, they could avoid this devastation of this horrible disease.
Most people that haven't gotten the vaccine just say that they're strong enough to fight off the virus. Is that true? Should they get the vaccine, or is there like a bigger picture that we're aiming for?
Oh, it's a great question. And so early on, many people think there's also a movement against vaccination. For many people believe that vaccinations are an artificial means of protecting your body. Now, that being said, statistically, you're probably okay. I mean, if you want to play the odds. But what if you're one of those, 1 out of 10 people, or 1 out of 8 people, 1 out of 5 people even? Let's say the odds are pretty good. 95% chance, let's take a 5% chance that you won't get very sick with it. Yeah, odds are good. But if you're one of those 20 people that potentially had a chance to basically fight this off, and instead you end up in an intensive care unit, you don't want to wake up to me. You don't want to wake up to see me up in your ICU because that means that you are in real trouble. I mean, it's been awful. From a physician perspective, it's one thing, but as a family member, community member, I mean, to watch your neighbors and friends basically fighting for their lives, and some of them not come off the ventilator, some of them die under your watch. It's been horrible, and I won't sugarcoat it. It's been probably one of the hardest things in my career. I've signed more death certificates in this last year and a half than my entire career combined to this date. And I don't know if people really realize that relatively healthy people have died, and I hate to say it, but most of those deaths now are avoidable. The other part is, what defines life? It's not just life or death. It's also illness. I mean, I'm now seeing people, we're all seeing people in the clinics now who, they survived, but to what? They have lung disease, may have blood clots, they may have heart disease, they may have had strokes, they may have had I have patients who are healthy, athletic people that basically can't smell, can't run anymore, can't do the things that they used to do 3 or 4 months out later. That's a little scary to me. If I could avoid that, sign me up. Sign me up for another vaccine, sign me up for the booster. I will take it because I've seen what happens to people that I've taken care of, and I don't want that for myself, my family, my community, my neighbor, anyone I care for, much less on a massive scale. I think our minds play real good tricks on us, and we are so many of the public is in denial. The news is out there. If you want to search for tragedy, it's out there. You can just pick up the phone, talk to family and friends. I'll tell you, I've taken care of patients in this continent, also family and friends in India. And the suffering and the toll it's taken doesn't take you long to get it. The problem is we've chosen to ignore what was out there. And when our brains choose, our public choose, and there's a political movement, let's be honest, to hide some of the reality, the tragedy of it all. And it's devastating. I mean, people are dying because of some of these choices that we're making as a society. And that's hard to watch. Families will suffer forever. Some of them families will never be whole again because of this virus. And why? I mean, to me, it's somewhat senseless.
There are some concerns from faith communities about the makeup of the Johnson & Johnson vaccine with human embryos. Could you specify or clarify anything about that?
Sure. These vaccines are artificially designed with mRNA, which is not DNA. The mRNA goes to the cell and it creates a protein that helps your body fight off the virus when it's exposed to it. But there's no DNA, it doesn't alter your DNA, there's no chip, there's no electronic transmission of anything. There's none of that. The embryo thing is not real. At the development point, did they use stem cells to test some of this? I think some of that has been blown out of proportion. Stem cells are used for a lot of scientific research. And so that's just part of the process. To create a new vaccine, you need to look at how it does in certain cell types. So that process was used, but there's none of that component is actually in the in the vaccine itself. I apologize. So no, there's no embryo. There's none of that sort of misleading information. And so I think what you're getting at is a very important part is, where are the facts? And I think the differentiation of facts versus opinion is very crucial, that we as a community understand what can be debated, what should be debated, and what is just simply not scientifically true.
Does it cause infertility?
As of now, based on the vast number of women that have received the vaccination while pregnant, some known, some unknown, and it does not seem to affect fertility at all, from what I understand. But the scientific community, this knowledge can change, and so we've been encouraging pregnant women with COVID exposure risks to be vaccinated for now. But that being said, I'm not the authority here. I will tell you that that's being actively looked at, and just talk, if women are thinking about getting vaccinated, contact their OBGYN, contact their physician, talk to their primary care doctor. They should really be in touch with the health community, and also look at the guidelines. The guidelines are made by very smart people who spent their entire career studying these things and want to really help the public stay safe.
There has been a lot of noise about the variant of the COVID-19 called Delta variant. Could you explain to us how that is affecting vaccinated and unvaccinated people differently?
So yes, unfortunately, the Delta variant is well known to people from India. It probably emerged from India predominantly, whereas took foothold and pretty much devastated that entire country. I mean, to the point where there were so many deaths that they're basically overwhelmed the entire country. The government may be affected because of this Delta variant. So many people, my own uncle died of the Delta variant. I've had family and friends basically die of this thing. It's more contagious. It's not sure whether it's more serious or not than what we saw back in the spring of 2020, but it's deadly. It's definitely occupying more of our intensive care and hospital resources now than ever. We're getting back up there now again because of the Delta variant. What's very clear is that it is the dominant strain now in the United States. It's about over 80% of the strains now in the United States, of the ones that have been sequenced or isolated, are the Delta variant. This thing is real. It's highly contagious. And so we're even seeing patients who've been vaccinated come down with a cold or an illness because the Delta variant has a certain predilection of just being so contagious. So all the more reason to step on the gas as a country, to really reach out to your friends, colleagues, anyone, get the message out. Get vaccinated now. You don't want to see what my country went through. It was so horrific that I think the graphical pictures of dead bodies on the sides of train stations and other places would almost be too hard to watch.
How does your Sikh identity affect your views on the vaccine, and how does that relate to your medical expertise?
Great. So the Sikh identity is pretty easy because we're big believers in the scientific process. We're big believers in that the community that humanity as a whole is good, that we are trying to, as a whole, to do the right thing, and that, and it also teaches humility that none of us knows the truth. The humility that I'm just a physician. I'm not the scientific authority in here. This is where the scientific community has to come together and guide us as individuals. And people who have the training, the expertise, the knowledge to lead us will do the right thing in that regard. Now, so the Sikh community strongly feels, and a lot of us were affected by COVID-19 from family members in India, so we are very much fearful of this virus. So we are strong advocates of safety, hand washing, hygiene, sanitization, as well as masking, and as much as possible when we're exposed, when the government tells us it's a good thing, as well as making sure that we're vaccinated.
How has COVID-19 affected your life?
How has COVID-19 affected my life? I don't even know how to even answer that question. It's affected everything in my life. On the negative side, obviously, it makes you really sad that society has to suffer from such a horrible disease process, and that it's running amok in many parts of the world. Talk about the U.S. where we have vaccines. Most of the world doesn't have access to these vaccines to the degree that we do, and that is sad. What's happening all over the world now? It's Mongolia or Burma or wherever the case may be. Sub-Saharan Africa. South America. Parts of South America are getting destroyed by the virus. That's sad. The other aspects of what makes me sad is that people question the integrity of the scientific community. That makes me sad, because that tells a deeper, darker part of humanity, that we believe what we want to believe, and we don't have the humility as a society to really look back and treat each other with respect and kindness, and understand who's really laying the line of who's looking out for ourselves, who's looking out for our neighbors, our family, and our friends. That's number two. On the positive side, it has made us all stop and think what's important in life. I don't waste a lot of time doing online meetings, that in-person meetings that may not be necessary. I spend more time with my family. I spend more time with my community. And it's nice to be needed or desired, I guess, or have a role in the society. As a pulmonologist, I have plenty of work. That's not a good thing, though. We were already in crisis before for my profession, for my field. We were in massive nursing crisis before this all started. Now we're beyond crisis mode in many healthcare professions, and people will suffer. And I don't know what to do. Then there's the economic parts of this whole thing. How will that play out? In many parts of India, I know, and in America, and parts of everywhere, all the entire world, this will affect us for generations. And I don't know what that's going to look like. So do the best we can. And I think, rather than moving forward with just gung-ho enthusiasm, let's stop and temper, and let's ask ourselves hard questions. And let's rely on the youth, like you all, to really guide us. Take this seriously, because us adults have screwed this up a little bit. Let's get the youth to kind of help us energize and figure out how to move forward as a society, because we'll all be dealing with this for many years to come.
Do you have anything to say to a person that's watching this right now who's trying to decide if they should get vaccinated or not?
Yeah, don't overthink it. It's the right choice. Look in your heart, if you know, and open your eyes to a perspective of someone who's seen this tragedy up front and close. Pay attention to those people who've seen this. Go call up somebody who's really suffered the consequences, then talk to them. Ask if they want to do over. I'll tell you, I still can see the eyes of my patients who've said, Doc, if I had a choice, I'd get vaccinated now. And they're on the verge of life support. Before I put them in a coma for their life support, I see them, and they have this look on them that just is a fear that they may not come out of this coma again. And their life will be different from here on out, and I know it before I put them on life support. Ask them, would you get the vaccine? And all of them would say, heck yeah. I've yet to see one that says, God, thank God I didn't get the vaccine in that situation. It's such an easy choice for me that I couldn't imagine. I couldn't imagine being on that. I cannot imagine what it's like to think I don't want the vaccine, because it's such a crystal clear choice.
Well, thank you so much for coming here with us. Hopefully this helps a lot of people. If you have any doubts about the vaccine, here it is, all laid out in front of you. Thanks so much, Dr. Singh.
Thanks for the time.